Neil is nominally a strength and conditioning coach in the lineage of the Postural Restoration Institute. I found his YouTube channel while perusing different explanations of lower back pain and was delighted by his multidisciplinary open-mindedness. His channel, which I'll link in the show notes, is one of the more valuable resources on understanding how the biomechanics of pain intersect with neurology. Welcome, Neil.
Thank you for having me.
And there's many things that I would love to touch upon, both about PRI, your different models of pain, and also about music at some point in your own experience. But to begin with, I'm wondering if I can try to explain to you what my understanding from PRI has been from your videos, and then you can correct.
Yeah, sure.
Okay.
Sure.
Cool. So my sense is that you emphasize that the Postural Restoration Institute's approach, it's not a system, but it's an explanation of how the human body organizes itself in space and time.
Yes.
The things that have helped me to understand PRI or what I see as some of the core principles are, first, it's very important to acknowledge this fundamental asymmetry in the body. So we tend to be right favoring. Another important part, and that's very important to understand because it has implications in our movement dysfunction and pain.
Yes.
The other principle is that while a lot of traditional physiotherapy focuses on local regions of the muscles, PRI emphasizes chains that extend across large regions of the body. So you talk about the PEC, or the posterior exterior chain. That's a grouping of muscles along the back that is implicated in anterior pelvic tilt. The AIC goes from your tensor fascia lata on your leg all the way up through your left diaphragm to your bicep. And that is another very important chain implicated in movement dysfunction. And the other principle that I hear you mention in your videos is that we are organized by our brain, and things have to make sense in context of sensory inputs to the brain. Yes. Rather than treating the body as muscles and bone, PRI is instead interested in this integrated system of how the brain and sensory inputs affect muscle contractions and tensions.
Correct.
Is there anything that you would add in terms of that level of principled understanding?
No, I think that's a pretty good explanation. And I think the key word is explanation. So from my perspective, postural restoration at this point in time is the best explanation of how inherently asymmetric human physical body and brain function, and the two hemispheres of the brain are not the same structurally.
Yeah.
They're not, I think it's called Yaklovian torque, something along those lines. But the two hemispheres of the brain themselves are in a bit of a twisted position. So torque and rotation is inherent. Asymmetrical torque and rotation is inherent not only in our movement patterns, because we're not symmetrical, but also in the structure of the brain itself. And then, of course, you have the lateralization issue that the right hemisphere and the left hemisphere, although there's considerable overlap, there is some quite specific specialization, particularly when it comes to language, the language centers of the brain being on the left side, and that language center's association with the right hand, which is well researched, and it's really fascinating. So it's all out there. Not the PRI, and the founder of postural restoration is Ron Haruska, certainly not me. The genius is in Nebraska. He's always said he didn't invent anything because PRI is, again, not a system. It's an explanation. Yeah. All of this information about asymmetry, brain function, body function, the asymmetry of our sensory systems, because the right eye and the left eye are different. Our ears are different. How our brain hears frequencies are different. That's all in the research. It's just no one has ever put it together. And most of it just people don't read. So he didn't invent anything. He just started to work in his professional life after physical therapy school he started with Vietnam veterans, and he had to prepare them for prostheses when they had amputations.
Yeah.
And his job was to prepare their nervous system for prostheses. And one of the things they had to do was reduce neck breathing, and they had to learn how to use their hips appropriately. especially because if they didn't have a leg, they had to meet certain milestones in terms of being able to move the pelvis and abduct and adduct their whatever was left of their legs. So from it, he never came to physical therapy from a biomechanical standpoint. It was all neurology from the beginning. One thing that people don't quite understand about posture restoration in the beginning is they tend to think of it as a system, another tool in the toolbox, or something alternative, which in reality that's not even remotely close to the case. The point is, if asymmetry has to be the starting point because that's how we're built. If you ignore asymmetry, you're ignoring the foundation of the model. You're now treating the body as if it were symmetrical. And
Mm.
it's the right side of your body and the left side of your body, they don't have the same challenges. The right leg has a challenge for external rotation. The left leg has a challenge for internal rotation. That's never going to change because of the asymmetry. So if you do the same exercise on the same or the same exercises for the same legs, it doesn't make any sense. And in fact, what happens is people end up reinforcing the pattern that they're already in because they're doing for the same legs, but in reality, and also the pelvis is not actually in a neutral position. They don't
Mhm.
realize, the traditional physical therapist is not going to realize that the pelvis is oriented to the right.
Mhm.
They don't see that. They think they're looking at someone who's completely straight, like I would have when I was strength and conditioning. I didn't know any of this. I just
Mhm.
assumed symmetry that wasn't there. And I assumed that people were actually straight when I was looking at them. Sometimes I saw they were lopsided, but I didn't understand what I was looking at. But back then, the idea of asymmetry inherently making the function of their left leg and their right leg, or their right arm and their left arm, or their neck as inherently different. Their behaviors are different. And if you treat both sides of the body the same way, because that's the thing. Oh, you do one exercise, 10 reps on the right, 10 reps on the left, same exercise. But the problem is this: if your pelvis and rib cage and spine and probably neck also are off centered to the right, you're not really using both sides of your body. Even if you're just using your left leg, your pelvis and body are still oriented to the right. And so you're not really using your left side at that point in time. Your,
Mhm.
your weight might be there, but unless your pelvis and whole torso can actually rotate to the left as your weight is on your left leg, you're not really on your left leg. So that's what people don't realize. So
Mhm.
doing a bilateral exercise doesn't really exist because you're not symmetric. So using two arms and two legs at the same time doesn't make sense to the brain.
Mhm.
Because, and you're not going to be doing it equally on both sides. I guarantee you that. It's impossible. You're not symmetric. How could you? So those
So,
are the biggest points of, to make it relatable to human or to people who may not know that much about pain and rehab. Uh, those are the underlying issues, that we are not symmetrical, and that asymmetry produces very predictable limitations in movement.
mhm.
That's what we treat, the limitations. We don't treat pain. Pain is a symptom. You can't treat it. What you do is we treat the position that body's in and the limitations based off of that position.
Would you say that in addition to the position, what really is important is the movement pattern? Because even when we're sitting still, we
Mm,
might think that's a static position, but really we're rocking forward and backwards
that's
over
really
time. And that's something that PRI also emphasizes, at least on the website, is the flow of air and the movement of air, which is a constant motion.
yes,
And then people also have this idea of posture as like something that's static, right?
right.
Can you speak to that dialogue?
Yeah. So it really depends on your perspective. You could say that our posture is just standing up straight, and that is a posture. But to me, posture is a dynamic process. The way that you stand and posture yourself is not coming from you consciously. It's coming from your brain. And it's based off of how your brain is incorporating external stimulus from the world. So visual space through your vision, auditory information through your ears, obviously, and then sense of the ground underneath your feet, and sense of your own body. and breathing, and obviously your vestibular system. So all of these systems that primarily run through your head, those are the biggest inputs for what our brain uses to figure out where we are in space. So your posture reflects how your brain is positioning you in relation to space and the ground. It has nothing to do with strengthening. It has nothing to do with standing up straight. It does have to do with how you're breathing, but how you're breathing is also based off of how you're sensing space, where your brain thinks you are, and how it's sensing the ground underneath you. So even breathing is not number one. Neurology is number one, but neurology is based off of how our brain operates based off of what it's sensing. In the rehab world, it's a very common thing to teach that sensory precedes motor. So
Mhm.
your motor output, your movement, your posture, however you want to call it, is based off of what your brain is sensing and then processing. That's the important thing to realize. So doing posture exercises really doesn't change a whole lot simply because you're only working on the output. If you want to change the output, you have to change the input. Working on
Mhm.
the output is not going to change the output.
One thread that I have been increasingly interested in is the limitation of this idea of treatment. If we
Mhm,
think about us as processes
mhm,
and you're just doing a thing, a fixed thing in time, you're not really changing the underlying generating patterns,
right.
right? How do you think about that?
Well, that's a moving target because we are a process, but our processes also change based off of environmental change, where we
Mhm,
are, who we're with. Are you on vacation or are you stuck in a lab? Are you staring at
mhm,
a computer screen? Are you sitting? Are you playing your favorite sport? All of those things will change the process of how we move. We're either threatened or we're not. It basically comes down to that. Either your brain likes it or it doesn't. When you like it and you're doing something enjoyable, your body's relaxed. If you're constrained by anything, whether it's a seat, a chair, sitting on an airplane for 10 hours with nowhere to go, most people don't feel great when they get up. Constrained by your environment, constrained by teachers telling you this is what you have to learn, constrained by society saying this is how you have to be, a religion, a family saying this is what you want. But if that's not what you want and that's not what you enjoy, that's very tension inducing, and that will affect how you move and how you posture yourself. And that can change over time because what we like can change. I always say when people ask me, are there any books written about this subject or how can I learn more about posture restoration? It's like, all right, first of all, if you want to learn posture restoration, you have to go all in. You can't do it part time. You really can't. You can't do a deep dive. There's no coming out of the dive because there's nothing that's not posture restoration. Because again, it's not a system, it's a description of how asymmetrical humans with an asymmetrical brain and body exist in a gravitational field where time and space are being made up by the brain itself. So through movement and feedback, you can't just dabble in posture restoration. You have to act like a neuroscientist. If you really want to understand posture restoration and how the body moves and pain, you really have to think more like a neuroscientist rather than a strength and conditioning coach or a physical therapist or even a doctor. That's how I look at it
mhm.
at this point in time. So
Yeah, that's
yeah,
mhm,
everything is changing. We're changing. We're always changing. It's a very Buddhist Eastern philosophy way to
mhm,
look at things. So if people say, "Oh, how do I learn PRI?" You're not gonna. It's gonna take a heck of a long time. But if you want to understand the big picture, just read a book of Buddhist philosophy. You have to let go.
mhm,
You're stuck on your right
mhm,
side. You're stuck. You have to let go. That's what it's about. It's a process of letting go. And when
mhm,
the organism is threatened, sometimes it doesn't let go and it stays on its right side because you're not going to stay in the middle and you're certainly not going to be on your left side. You're going to be on your right side. And that's what the testing shows. Whenever you see the testing on any like my videos, you see a shoulder that doesn't internally rotate or a neck that can't side bend to the right or a left leg that can't go down or adduct. That's just telling you they're on the right side. It's just tension. When threatened, we move to the right. That's where our tension settles. That's where our movement settles. That's where our energy stops flowing when we get on the right side. And that's a fight or flight position. But we got to get that energy moving again. We got to get flow back into us. But sometimes when threat or injury goes on for too long, or instability, anything that's threatening the organism or the brain's sense of its own survival or its own self, that's a threat, and you stay on your right side. And when you stay on your right side for too long, that's a loss of flow. That's a loss of energetic flow. It's a loss of normal human movement, and that affects brain function. That is your brain. The physical body is not the issue,
Mhm.
unless again because
Mhm.
there's no injury. And how strong do you have to be to really walk and breathe? That's all posture restoration is. Walking is mostly momentum. After the initial push, your calves do work to push forward also while you walk, but for the most part, walking is not a heavily muscular activity. It's mostly just momentum.
Mhm.
So it's not a strength issue for most
Right.
people. For most people.
Yeah, yeah. This is hitting on many threads that I'm interested in. But just to come back a little bit to this question about treatment,
Mhm,
one lens that I've been playing around with, which it sounds like you're sympathetic to, but I'd like to hear more specifically your response, is that what we want to induce is learning in
mhm.
the nervous system and in the brain.
Yes.
So treatment comes from this paradigm or this world of it's like you're a car or you're some kind of mechanical thing and you do a change and that change just lasts. But if we acknowledge that we are dynamic processes, what happens when there's learning is that there's actually a change in memory and the generating processes too. And
Mhm,
so you when you're trying to do things like allow the the person and their system to let go of this habitual pattern of turning to the right,
mhm,
you're inducing this learning change where they
mhm.
can move between the left and the right
Correct.
more evenly as they walk. One thing that's interesting to me in your description is that our left and right are clearly asymmetric. How baked in? How what does left and right mean to the brain?
Not a whole lot. I don't think it knows what left and right are. I think because
Right.
left and right don't exist in the universe.
But we
Just like
have the left and the right hemisphere though that are connected across.
yeah, we have two
Right.
hemispheres, but we label them left and right as humans. The brain doesn't know there's a left and a right. It just is. It's the
Mhm.
same thing with oneness. We have the ability to look at ourselves as individuals, but we also have the ability to look at ourselves as part of something bigger. And when
Mhm.
people are too individualistic, you call it selfishness, you call it they don't care about other people, whatever it's going to be. You look at yourself in isolation. And again, Eastern philosophy is trying to get you to see yourself as a part of a greater whole. You're not this thin layer of skin does not mean you're separate from the environment that you're existing in. You exist
Mhm.
in an environment, and that's what your brain has to figure out. Your brain has to figure out what your own body is doing. It doesn't know. And when it loses sensory inputs, it drops off to one side. The question of left and right, what does left and right mean? There's actually a great book about it. It's called Left Hand, Right Hand. I
Mhm.
think it's called The Origins of Asymmetry in the Universe and the Human Body, something along those lines. And they talk and they
Mhm.
have a specific chapter about left and right. It's just that
Mhm.
it gives us the ability to describe a location so we can communicate.
Mhm.
Humans. Dogs are not talking about left and right.
Yeah, and it's always relative to us. It's like
It
left and
is.
right of what, right?
Yeah. It doesn't exist. It's relative. It's a comparison. And there's some cultures that don't even use left and right. They use, oh, your ear that's towards the river,
Mhm.
or your ear toward that's not towards the river. You have to know exactly that perfect geography to understand it. But there's numerous books that talk about how these ideas of direction are different in different cultures. We don't all
Mhm.
use the same understand, even of time is different
Mhm.
cultures have different ideas of time. If anyone has ever, if you're American and you travel and you now go to other countries, like maybe South America, India,
Yeah.
Spain, wherever it may be,
They're
they may
feeling of time's
often
different.
a very different sense of timing than we
Yeah.
do. Like, we tend to be very punctual. In certain countries, if the party starts at 8, no one shows up until 11.
Mhm.
And but they all know what it means. They all know no one's going to show up till 11, so it's not an issue. But to us, we'll show up at 8. And then it's like, where is everybody? They're all late.
Mhm.
And they say,
Mhm.
no, way too early. Oh, it doesn't mean 8 o'clock. It means 11 o'clock. Don't you know that? No, you don't know that until you
Mhm.
experience the culture. So our notions of time and space and direction are cultural, that are not shared everywhere. The idea of past, present, and future don't even possessive nouns. Oh, this is mine, this is yours. That doesn't exist in every culture.
Mhm.
It exists mostly now because everything has become so homogenized, just because of the interconnectivity of the earth at this point in time. But there are still cultures that don't have these references to left, past, future, now, and then his and hers, or mine and yours. So those are our ways of looking at things. I would love to be able to test people from these cultures to see how
Mhm.
their bodies respond to different things that I would work with them on. So
Yeah,
I have a
you
feeling,
might have to go into the Amazon.
yeah. Unfortunately, I just read a book. I just read an article that the internet has reached Amazon tribes that have
Mhm.
never had it before, and all of a sudden the kids don't want to do anything except look at videos.
Mhm.
I said, "Oh, that's not a good
Yeah.
thing. It's already
Yeah.
it's just hijacking their brains, just like it
Mhm.
hijacks all our brains."
Yeah. Yeah.
Yeah. So left and right, we talk about left and right, but from a brain perspective, it doesn't know what the left and it's responding to signals from the ground underneath the right foot, and then it responds to signals from ground underneath the left foot. It responds to pressure inside the right hip joint and the right diaphragm, and it responds to pressure inside the left hip joint and the left diaphragm. And those pressure differentials, or those pressure sites, are not symmetrical because of the internal organization and muscle structure. We're going to sense more on the right than on the left under normal conditions.
I want to get back to the broader philosophical
Mhm.
view, but I think it would be quite interesting to hear how you, with your PRI understanding, would interpret some of the common conditions or ailments that people have. Non-specific lower back pain. What, in your view, is going on there?
The inability to sense the ground, which then leads to the inability to diaphragmatically breathe. That's what it's really going to come down to. Now, you can say, I know I'm on the ground. And yeah, you do. But unless you're going through a full cycle of heel, arch, big toe, your brain does not understand the ground because it has to sense pressure underneath those three areas of the foot in a sequence. It's like a waltz, 3/4 timing. It's got to get those three beats in: heel, arch, big toe, and stress the heel, arch, big toe. But when you're patterned and you shift over onto your right side and you stay there too much, or if you're sitting too much on your right butt too much, you stand up, you're still on your right side. And now that inability to fully shift, I'm not saying you're not going to go to the left, you're not going to get all the way there. And now you don't accomplish a full cycle underneath either foot. So your brain's recognition of the ground is decreased. And now tension increases as you lost sense of the ground. And as you lose sense of the ground and you become ungrounded, you arch, you extend, we call it extension, you get tense. And once you get tense, you can no longer diaphragmatically breathe, particularly with the left diaphragm. And so what you're going to do is you're going to start to use accessory breathing muscles. And that's usually where the back pain is coming from.
Hmm.
In-
Does that imply to you that treatment modalities that don't directly ground, whether it's massage or awareness type stuff, is not going to fundamentally resolve lower back pain?
that would be a distinct possibility, yes.
Hmm.
Now, because of the subjectivity of pain, the one thing I learned in high school sports, I can't say I learned a lot, but the one thing I did learn is my football coach used to say, your body doesn't hurt as much when you win. And
Hmm.
it's true. When you win, you could have gotten the heck beaten out of you physically during the game. But if you
Yeah.
win, oh, that pain is not so bad. But if you get
Hmm.
killed, that pain is misery. So it's
Yeah.
very subjective. Like what people
Hmm.
can deal with in one situation might not bother them in another situation if they were living a happier life. There's a very famous book by John Sarno.
Yes.
You know,
Healing back pain, the mind body
yeah,
syndrome.
even with that back pain, the underlying issue is tension. You're tense. So whatever induces tension or whatever resolves tension can resolve pain, idiopathic pain. So I'm not saying everyone has to do a PRI program to resolve back pain. Obviously, for enough people, they could go see John Sarno or read the book. And once they realized that there was nothing structurally wrong with them, that was enough to reduce their tension levels. They didn't have to worry anymore that there was something physically wrong. And if people accepted that diagnosis, now there's an issue with that, but if well, that's not even a diagnosis, it's just saying there's nothing wrong with you. It's most likely coming from repressed feelings. Or anger was his main point of it. That's autonomic nervous system tension. And the pain that you're feeling in your back is obviously generated from your autonomic nervous system. There's no damage. So, what's the thing that individual is going to need? That's why there is no one game plan for every PRI client / patient. That's why you can't mass produce posture restoration, because I can't say exactly where this person's tension is coming from. But does tension reduce your ability to diaphragmatically breathe? Yes. Any psychologist can tell you that. Fight or flight. That's all we're talking about. Does the inability to fully get to your left side and stabilize on your left side reduce your ability to use your left diaphragm, which is smaller than the right diaphragm because you have two, and that's a big deal? That will, yes, if you cannot get to your left fully and you can't heel strike on the left, which most people can't after a certain age, they lose it. If they become unstable through their left hip, and that's mainly where the instability comes in, does that reduce their ability to use their left diaphragm? Yes. Will that push your tension levels up? Yes, it will. Will that make you more likely to stay more on your right side? Yes, it will. But I can have people walk to music and that tension reduces immediately and they pass all their tests. Doesn't mean they're stable. But if someone is stable enough, because not everyone has a ton of instability. So in their pelvis, particularly in the front of the left hip, they might have a perfectly stable left hip. And so for people like that, oh, you mean there's nothing really wrong with me? Oh, that's a relief. That could be enough for the pain to go away.
So the unifying thing between the mind-body syndrome people and PRI is this recognition that tension is the underlying principle that you're trying to address.
That's what Sarno said. It's being generated by the autonomic nervous system for some reason. And that's what we as PRI practitioners are. He's not even trying to figure out where it was coming from because he thought it was all in the subconscious. So, and he's like, you're never not going to know because it's somewhere down there. But the job of a PRI therapist is to find out where is that tension coming from. And that's what we do. It can come from anything that threatens the brain, whether it's the loss of vision, hearing loss. It could anything that disrupts your brain's ability to navigate space is a threat, because now you're in a threat to fall down, and falling down is death.
For you, does the repressed emotions come to be a useful lens?
Yeah, because a lot of people are traumatized, and they're not necessarily going to tell you. But when I could say that, if you ever read the book Polyvagal Theory or The Body Keeps the Score, they're talking about the brain is constantly looking for threat. And sometimes those threat detection level or sensors are over sensitized and they start reacting to things that they shouldn't react to.
Yep.
And your body stays so your body stays in a constant, and that's what happens with trauma and post-traumatic stress. You're continually reacting to events in the past because your brain gets reminded of them. And this goes into the amygdala, this goes into the fear circuits, fear learning and then fear inhibition, or fear unlearning, because you have to actively unlearn the fear. It doesn't just go away. So you have to make new memories. But yeah, there's so many ways that this discussion can go. Just read books. Read one of the books by Robert Sapolsky, why zebras don't get. Yeah. Oh yeah, absolutely. Any of those books, any of his books, that's telling you what's going on. Yeah.
Yes. So it's wonderful if we begin to make the whole circuit too. I was also curious about some of how you might think about some of the other things too. For example, wrist pain. People who complain about this like forearm stuff when they're typing a lot. how might you relate that to the asymmetry, the tension?
When we walk, hands have to go through cycles. Remember, everything has to cycle. That's the issue.
Mm-hmm.
That means we need a right side of our body and a left side of the body. Arms have to swing, one forward, one back. Feet have to supinate and pronate. Legs have to internally rotate. Everything has to cycle.
Yep.
Asymmetry, when that normal asymmetry, which is not an issue, when that normal asymmetry becomes too asymmetrical because of life, whatever happens, and we stay on our right side, we're no longer cycling. We're not going through internal and external rotation. And the wrists will not go through cycles of supination and pronation. The more you keep your hands in a pronated position. So I don't know if you're listening on a podcast, you're not going to see it. But as you bring your hands into a more pronated position, your shoulders are often going to start to get tense and your necks are going to get tense. Things are going to start to rise up over time because you're bringing everything in. You got to get your arms away. That will relax you. But the more you stay in one position with your hands as you type, your shoulder blades now can no longer, it's going to be a shoulder blade issue, to be honest. Your shoulder blades are going to go into abnormal positions as your rib cage goes into abnormal positions. And now it's going to affect your breathing. But what's really going to happen is because your arms are no longer going through cycles of supination and pronation, because your hands are down in a typing position the whole time, you're putting tons of stress on that system. The tension goes up immediately. And that's the problem. So it's really going to come from your shoulder blades. So you have to restore. So how would I relieve someone or help someone relieve their carpal tunnel syndrome pain or wrist pain or elbow pain, maybe because they're on the computer too much? They have to restore arm swing as they walk. And then they have to do stuff that's with their hands that are not in a pronated position. They got to create things. Look at the homunculus. Our hands are the key. They're gigantic in terms of our cortical representation of hands.
Yeah.
Bigger than any other part of our body. And yet because they explore, that's how we lived as humans. We got our arms doing things and reaching and grasping and creating. We don't create anything anymore. And in fact, just as an interesting example, I had a woman come see me a couple months ago, and I know when I see a jaw that's off-centered, particularly if it's to the right. It's too complicated to get into on this discussion, but jaws that are shifted to the right are not a good sign. Okay. When you see someone with a jaw to the right, they're going to be pretty restricted, and they're usually going to need dental help to help reduce the tension in their body. Not to reposition the jaw, but to just a mouth guard type of situation, help relieve the tension. But her testing was remarkably good. I was shocked. And her jaw was way to the right. So her mandible, the jaw and the top part, the maxilla, they were not aligned. It was shifted, which tells me I know her neck is tense. And if your neck is tense, that's your autonomic nervous system. So, but her testing was actually really good. And she actually got most of her tests to clear through normal PRI techniques that the average person with a jaw to the right would not be able to do. And I was one of those people. So I know I have firsthand experience of this. But what she did for a living, and I honestly think this is the key, she's a professional knitter. She uses her hands in very dexterous ways. And that has a huge, because our hands are so overrepresented in our brain's cortex, in the homunculus, the motor cortex. I think that's actually why she's kept herself in a functioning way. She even had scoliosis. She has a lot of things working against her, but her testing was remarkably good for a person in her situation that I would not expect. I was shocked, I'm not gonna lie, but I honestly think it was because she uses her hands in such dexterous ways.
Is it the dexterousness, but also the fact that she's supinating and pronating quite a bit with the sewing?
Part of it, yeah, probably.
Because I also think of musicians too, violin players, piano players.
They use them constantly in the same position. Yeah.
And so your one hypothesis you have is that this constancy of position
Mhm.
is generating this tension around the shoulders, which is also implicating the breath and causing an overall pattern of tension that they
Tension.
feel and experience in their
Yeah.
forearms and
Yeah.
wrists.
Yeah. Yeah.
Mhm,
Yeah.
mhm.
It's not uncommon.
How about so I'm one of the things I'm quite intrigued about is the emphasis on jaw and jaw tension. So people do have uneven jaws. Do you have a sense of what's going on when people grind their teeth?
It could certainly be a search for stabilization on
Mhm,
an unstable body. The
mhm,
amount of people who come to see me that on their questionnaire, they write down that they grind, it's a lot.
mhm.
And these are people who come in with pain issues that I'm trying to
Yeah.
help them with. And do they
Mhm,
all have unstable left hips? Yeah.
mhm.
They have instability in one of their shoulders also? Yeah. In their right lower back area, their iliolumbar ligament area? Yeah. To me, it's just a sign of brain's attempt to stabilize. Again, autonomics. It's
Mhm,
always going to come down to autonomics. It's tension or relaxation. If you're stable and your brain can figure out where you are in space, you'll be relaxed. If you become the more unstable you get, and the more you rely on neck breathing, because that's what happens when you're unstable, the more tense you're going to get, and
So
the
so ten Mhm.
less variability you're going to have.
It seems to me that also you could understand all tension as a search for stability. When you're trying to contract anything, it's you're just trying to find ground and unable to. That's why the tension is still there.
Yes, and we
So
have to ground you for the tension to go away. That's
mhm,
what and most people have simply lost the ground underneath their left heel.
mhm.
Most people.
So have you found that the grounding of the left heel will do things like stop people grinding their teeth?
I have closed people's open bites for restoring ground underneath their left heel.
Mhm,
So I even have pictures. I don't know if I've actually done a YouTube video about it, but I had a woman come in not too long ago. She's being treated for TMJ. Now, unfortunately, she already paid a lot of money for the treatment, and she's going to go through with it. Where I don't even think she needs it at this point,
yeah.
because she got TMJ treatment because she had an open bite and her jaw was shifted a little bit.
Wait,
And
what's an
so,
open bite?
oh, it means the teeth don't touch where they should. So if you bring your teeth together, there should be your molars should touch.
Right.
Top teeth should come down in front of your bottom teeth, but you
Yeah.
should feel your molars first, and then you should have to move your jaw. As if you bring your teeth together, when you bite down, you should feel posterior or contact in the back first, and then you should have to slide your jaw forward a little bit to feel your front teeth.
Mhm.
That's a normal occlusion. Occlusion is the dental term for how your teeth touch. Occlusion just
Right.
means two surfaces touching. You have
Mhm.
occlusion all over the place, but for dental, they just call it occlusion. So that's normal occlusion. A lot of people, what they'll find is when I ask them that question, they'll often say, I feel my right molars more than my left. That's a normal pattern because they're on the right side. I expect to hear that. I'm fine with that answer. It's a normal pattern. But if they say, you know what, I feel my right canines, or I feel the front of my teeth more than the back, that's an
Mhm.
abnormal occlusal state. And that can only happen if you lose grounding. Your head and neck fall forward and it changes the angle of your bite.
Do people ever come in with they feel their left molars more than their right?
They do. And then I think to myself, how did that happen?
Uh-huh.
It's an abnormal pattern.
How rare would you say?
It's not that it's rare, it just doesn't fit a right dominant human, which that person is.
But
So
it would be if you're saying that the right is more common, then the left is comparatively less common, people who feel their left first.
correct. You're going to find it. So when I say it's common in the fact that, yeah, some people do, but it's not appropriate. Right molar contact, having more right molar contact, I'm not worried about that. It just goes
Okay.
up with a body that's centered over the right side. There's actually research there's a study from Japan, and I don't remember what the age group was that they were testing, but they said that when someone bites down on one side of their mouth, let's say you bite down with your right teeth, and if you're in a standing
Mhm.
position, they were studying the role of the stomatognathic system, which is the jaw, the teeth, and the associated musculature, uh, the influence on posture. And so what they found was when someone bites down on the right, which activates the right jaw musculature, their pressure, their weight increases on that side. So they're measuring it from a platform underneath their feet. But that's the way it works. When I bring my teeth together on the right, my body moves to the right. If I bring my teeth together on the left, my body moves to the left. That's built into us. There's no way to stop that process unless
Right.
unless you become extended into one of these postures. I
Mhm.
want to see that happen. So if I have someone change their bite to the left or the right and there's no movement of their body at all, like
Mhm.
they're really tight.
Yeah.
So it's just a lack of freedom.
Mm.
So when people have more left molar contact or they sense their left molars more, of course, I would always look to see if the midline of their top teeth and the midline of their bottom teeth, are they actually in line with each other?
Mhm.
If they are, but you're still sensing the left molars more, when in reality, if you're in that type of situation, you really should feel your right molars more. It could be something as simple as too much neck tension that has just thrown off some of the alignment of the jaw in relation to the upper teeth. It
Mhm.
could be vision. There's a lot of influences that can cause that inappropriate molar sense. I'm not even
Mhm.
saying it's serious. It's just, it would, to me, it would say, what is that person wearing on their feet? What type of shoes do they wear? How is
Mhm.
that brain sensing the ground? Something got disorganized. That's all
Mhm.
it's to me. I want
Mm.
everything on the right. That's normal lateralization.
Mhm.
Right eye, right ear, right hand, right foot. There's a reason 90% of the world's right-handed and right eye dominant. And there's a reason 90% of the world choose with the right side, with their right teeth more than their left.
Yeah.
So I'm just looking for normal asymmetry. It's when you get abnormal asymmetry. It could be a mixed dominance issue. That person might have a left eye that's dominant or a left ear that's dominant. They could be left-handed, and it throws things off just slightly.
Mhm. So the dentists, when usually encountering people who like will grind their teeth, give them a mouth guard, say
Mm,
like you should put something between your teeth. What you would say is actually what you need to do is to become grounded.
mhm.
And how you would think about it is to do these different tests, which are basically tests for groundedness,
They are.
and then see which parts need the most help and then check in with that. Is that
Yeah,
right?
that could change your bite immediately.
Mm.
The moment you find a left hamstring or a left inner thigh with your pelvis that's actually turned to the left, and for the
Mhm.
first time you breathe with your left diaphragm, and now your neck doesn't need to work because your jaw is embedded in neck muscle. It really just hangs off of your head. That's the
Mhm.
great teaching that I've learned. One of the great things I've learned through PRI is that muscularly speaking, the jaw is really part of your neck. It's not part of your head.
Hmm.
So it's hugely influenced. Jaw position and TMJ function is hugely influenced by how you breathe and how you move.
Are
It's
you
not,
saying it's part of your neck because of these muscles here,
yep, that's part of them. And then also, but in particular, the sternocleidomastoid muscles.
which moves, which are
Yep.
along here,
Yeah.
right?
Because they attach not only to your sternum and your collarbone, but they attach to your temporal bones, which are the
Mhm.
T in the TMJ. And they can start to move jaws because they're
Mhm.
big time accessory breathing muscles and they rotate your head. So when you get stuck in one position and your head has to stay in a constant state of rotation to stay straight, you
Mhm.
already have asymmetrical forces on those neck muscles that then start to pull on the cranial bones and warp them a little bit.
Mhm.
It's time under tension. The longer you go, the more things are going to start to torque
Mhm.
inappropriately. And some people get so torqued, like I was, through my cranium and my mandible, that I needed dental help through a mouth guard, a specially made mouth guard for PRI purposes, to help get everything, straightened out, to
Mm.
unwind, essentially. Once the jaw is involved, really involved, the rest of the body is held hostage because of the influence of the neck on the rest of the body.
Mm. One thing you said before was that the PRI interventions are pretty specific, or how you think about it depends on the context and the individual.
Right.
But I wonder if you have some sense of just fairly universal things that are quite effective for grounding.
Yeah. First, you'd want to be able to sense your left heel hitting the ground
Mhm.
as you walk. paying attention to space, visual space on your left flow past you. It's called optic flow as you're moving. You could get most people to change. You could change most of their ostensibly biomechanical tests, which we now know are not biomechanical. They're tests of grounding or tension. You
Yeah.
can change a lot of those tests just through someone having their left heel hitting the ground with the appropriate shoe, which has to have a stable heel, and noticing the world passing them by on the left side because their brain dropped off those senses because they were too far on the right. If you're not on your left, your brain's going to stop paying attention to the left. It's really what your brain is paying attention to. And most people don't realize they're not heel striking. They don't know that. But if I see them walking and their hands are still pronated, which you often see, and their hands are basically facing backwards when they walk and you don't see arms swinging, they're not heel striking. There's no way. Hands have to be able to supinate to heel strike. So I can get people to heel strike by putting cones in their hand that put their hands in a more supinated position. And now it checks that their arms start to swing more. Their brain picks up on their arm swing. It actually sees the arm swing. It sees arms alternating or hands coming up into their periphery. And those are all signals of flow. It's rhythmic. That's where the music comes in.
Mm-hmm.
I have to get these individuals flowing again. Their energy stopped on their right side. And they have a stopping issue more than a moving issue.
Mm-hmm.
They're not stopping in a state of rest. They're stopping in a unilateral position, or they're stopped with a body that got stopped oriented to the right. They begin and end their day on their right side, and they might never actually use their left side appropriately. And that's the problem.
I want to hear more about the music and treatment, but one thing piqued my interest in your description there, which is that you said the shoe should have some kind of heel support.
Correct.
Now, naively, I would think that we learn dynamically in interaction with the environment, and we, for most of our history as human beings, did not have supported shoes. So you get this feedback and you adjust. But what's wrong with that picture there?
It's pretty simple, actually. So even ancient civilizations wore sandals and shoes. If you see the sculptures, they're often wearing. The Romans wore sandals.
What about the Paraha Amazonians or the Kalahari Bushmen?
Yeah, they probably live on real Earth. Once you start to live on flat floors and streets, that natural undulating surface that neatly fills the arch of that foot, and that undulating uneven ground that hits the foot with every step you take from various directions because it's not flat.
Yeah.
That's what the human foot is mechanically designed for.
Mm-hmm.
It wasn't designed or didn't evolve on flat surfaces.
Mm-hmm.
Real Earth is undulating. Your foot is undulating if it has an arch, and mine does. Most people do.
Mm-hmm.
Some people have flat feet, and that's a different issue. But your undulating foot needs undulating ground. It's how testosterone or any type of chemical in your body fits a receptor.
Mm-hmm.
It has to have the right fit to get into a cell. It has to lock in with it has the proper shape.
Mm-hmm.
A three-dimensional foot, actually it's multi-dimensional, has more than three, it's very maneuverable. It's maneuverable because it's supposed to react to multi-dimensional Earth.
Mm-hmm.
Flat floors are very one-dimensional, and that's the problem.
So in addition to the left heel with a supported foot on a flat surface, would you say that similarly walking on uneven surfaces can help reground?
If you're barefoot, being barefoot or wearing barefoot type of shoe or minimalist shoes is perfectly fine if you're on real Earth.
Mm-hmm.
But most of us don't live like that. In Cambridge, I'm not sure that's where you're living.
Some of the brick sidewalks are pretty uneven.
Oh, the cobblestone. Yeah, that could be true. Those might be a little bit uncomfortable to be barefoot on.
Mm-hmm.
But at any rate, we need heel sense and arch sense to go through a full cycle of heel, arch, big toe. That's really what it comes down to. And I don't really care what people wear. I care what their testing is saying. Right. If the only way you can shut off your hip flexors and decrease your neck tension is when you put on a different pair of shoes, you can't go back to your minimalist shoes and expect a different outcome. And I've had people, recently, this one younger guy, he's like 23, I don't know. And every time he comes, he's in his minimalist shoes. And I keep saying, why are you wearing these? You're not going to be, I can't help you. He's like, no, this time it'll work. This time it'll work. Hasn't worked yet. Now, so what happens? He does his PRI techniques, he does his exercises, which help. But then he just goes right back to his minimalist shoes again, and it undoes everything. So it doesn't allow this learning, this neuromuscular relearning stabilization. It doesn't allow it to take hold because he does the techniques for 5 minutes, and then he gets up on it and goes on his merry way, and now his brain is still not recognizing the ground. So it all goes for naught. So can I wear whatever I want right now? Yeah, because now I'm stable. I'm grounded. So wearing my Brazilian flip-flops, which I love, or being barefoot in the house, it's not going to affect me like it used to because I'm stable. But when people already have, if you talk about this pattern of tension of right dominance who's stuck there, by definition, they've lost the ground underneath their left foot. It's a loss of grounding. So you need something that will get your brain to re-understand how to use the ground. But barefoot and minimal shoes are not going to work if you've already been wearing those. That's just going to reinforce what's already going on. So that's why we need a sneaker that we don't do it for support. We do it to provide the appropriate sensory input to that brain to re-understand a cycle of heel, arch, big toe, so you can shift from side to side. That's it. And that's really the issue. I don't care what people wear. I'm not married. There's nothing. I have no emotional attachment to choice of shoes. You can either pass the tests and stay neutral, and then you have a chance of stabilizing, or you can't. What we wish we could wear or what we want to wear, that doesn't necessarily conform to what I'm seeing. So you have to let go. Again, you have to let go of preconceived notions and theories or because it seems intuitive that, wearing shoes is not how humans evolved. We also didn't evolve on flat floors and streets. We're already living in unnatural circumstances.
So when we listen to music, and you talked about the person who walking in time to music grounded them, I'm curious about the mechanism there, but also how can that create a lasting shift?
So the brain inherently works on rhythms. There's a great book, Rhythms of the Brain.
Yeah, Busaki.
Yeah. That just tells you right there. And not only that, though, just how our brain self-organizes its activity. It doesn't need external input to generate rhythms, to generate brain waves. It's not just stimulus response. There's also inherent brain activity in all of us that doesn't seem to have a stimulus. It's self-organizing. Yeah. And they're still trying to figure out maybe how that happens, but nonetheless, it's there. So the brain works on rhythms: alpha rhythms, beta rhythms, theta rhythms, delta rhythms, and gamma rhythms. I think those are the 5. And they're brain waves, and they're different hertz, right? They're different speeds. So inherently, we're rhythmic. Because rhythm is just rhythm is a word to describe a cycle. The 24 hours in a day, that's a cycle. Night and morning, light and dark, those are all cycles that our brain links up to. Our hormones fluctuate in cycles. Menstrual periods are for most people, are pretty regimented. And they know that cycles or menstrual cycles will sometimes synchronize with other people. That's what our brains do. They synchronize with cycles, circadian rhythms, whatever it's going to be. That's what we are. We are rhythms. Our breathing is rhythmic. And unique to us. Some people breathe 10 times a minute. Some people breathe 6 times a minute. We're all different slightly, but we're all going through cycles. Walking is a cycle: right, left, left. If you only have one, you no longer have a cycle. So if you never get on your left, your cycling has broken down. If you don't go heel, arch, big toe, your cycling has broken down. And your brain will notice that. You lose rhythm. Walking should be rhythmic activity. Look on YouTube, type in rhythm and Parkinson's disease, and see the difference when someone with Parkinson's walks on beat or walks to external music compared to when they don't. That's why dancing is an accepted and something called rock steady boxing, where you're punching bags to a beat. That's why rhythm is such a big deal in treating anything with a basal ganglia disease, which doesn't allow you to move. It's a neurological disorder, and the movement areas of the brain can't work properly because they can't initiate movement correctly. And that's but I can synchronize. So if someone's inherently asymmetric and they become too right dominant and they're never really shifting fully to the left, that's going to show up in the testing. They're walking off beat, their internal metronome, their sense of timing inherently internally is thrown off. So you can sync them up with an external beat. And now, because remember, they're going to be spending too much time on the right foot, not enough time on the left foot. So they're spending 1.25 beats on the right foot and only 3/4 of a beat on the left foot. If they have to synchronize their heel strikes with the music, is going to keep them on beat. So the tension falls away.
Pragmatically, how much music exposure can lead, how long does it last? If you walk on beat for 10 minutes, does that go for the rest of the day? And how does that become incorporated to a way of being?
It keeps your nervous system relaxed. So when because it gives a sense of flow. That's how your brain figures out what you're doing, by optic flow, the sense of the world passing you by on the right side and the world passing you by on the left side. Vestibular signals of head direction and where it is in relation to your chest. Those
So
are
as
all
long as you're relaxed,
yes.
as long as you're able to remain relaxed, then that's also the time that you can remain grounded.
Yes, that's absolutely it.
Differs pretty highly between different people and their world environments.
If you're a researcher and you're sitting at a desk all day, staring at a screen, your flow is gone. Your brain doesn't know where you are anymore, because all the signals that gives it the sense of where you are have shut off. There's no movement, breathing, but in a mouse, but that's not a lot. Those signals are not telling you where your brain is. Those signals are not telling your brain where your body is in space. It only understands that from these signals of optic flow, anything that's coming through the cranium, and then ground pressure, so vision, hearing, airflow through the nostrils even, because as your head rotates ever so slightly as you're moving forward, that rotation is giving you sense from the right and then sense from the left, right from the left. So that's flow. It has to alternate. The physical body is really not the issue. If your feet are flowing, your vision's flowing, your auditory system is flowing, you will stay relaxed. You probably would never need PRI at that point. It's modern life that makes us need PRI, because the whole goal of PRI is to restore flow. But you can do a lot of things to restore flow. And dancing is by far the best, because all of those elements are included. The auditory system is being stimulated by rhythms. Your visual system is being stimulated by other dancers all around you. You're staying aware peripherally because your brain you have to, because you don't want to crash into people. Your feet are staying in time with the flow of the other dancers. I can get people neutral by having someone watch someone else walk to a rhythm. I've done that numerous times. I've even shown videos of it. No one understands it, but that's it. Because you pick up, you mirror them. It's a timekeeper. You can use visual cues to set time, or you can use auditory cues. Auditory is more impactful than vision, but either one can be a metronome. It's timekeeping. If you're on time, you're going to be
come across. Have you come across this Joseph Jordania book, Why Do People Sing? Music and Evolution, and music in human evolution. And basically, that was one of the first. He comes from an anthropologist, archaeologist perspective, and is very interested in this question of why do we see. First, he starts off the observation that when you go into the foothills of the Himalayas, and then you listen to the notes, you transcribe the harmonies that people have, and then you go to parts of Romania, totally different places, and you listen to the same polyphonies, and then you look at the sheet music, and it's like indistinguishable, very similar. So he
Mhm.
starts with this observation that there's this like deep role that music and polyphony has played in human culture.
Yeah.
And he ends up coming up with this very crazy hypothesis, which is it was a big part of our hunting rituals. We would gather and we'd sing in polyphony to scare
Mhm.
away the lion once it killed the hyena. But he repeatedly makes this point of the importance of dance and music
Yeah.
as not just like culturally meaningful, but as one of the core coordinating rhythms in our lives and also in the moments and bringing us into trance and bringing us into coordination with each other.
Yeah. Social bonding.
So yeah, yeah. So
Absolutely. Yeah, that's that type of stuff. Yeah, I haven't read that book in particular. I've researched this topic a lot, and I'm all in on this
yeah,
right now because I'm actually gonna be
yeah.
probably presenting at one of the PRI seminars about this.
Oh, cool.
But yeah, there's a lot of books that talk about the same type of thing that it not only so the whole social bonding aspect, because humans are very social, that could be a big part of it. And there's even research that shows that people enjoy things more when they're doing it with others. So just the enjoyment of dancing. Dancing by myself, I don't find enjoyable. Dancing with partners, so I wouldn't be like a hip hopper. That I like dancing with a partner. So that's why I do Latin dancing. That's why I've been dancing salsa for so long. So that's what I like. But I also know that when our two bodies are synchronized and moving to the beat, that's relaxing. That's keeping my nervous system relaxed.
Mhm.
Now, if that person is dancing offbeat, forget about it.
Yeah, that's
It
dysregulating, if anything.
exactly. Yeah, that's what I'm pointing out. I can tap somebody and they can go neutral. The
With
moment
music.
if they're hearing the music and I just tap them with the beat, they'll go neutral.
Mhm.
They'll pass some of their test. I can't say every single test, but I've done it
Mhm.
before. That's what I'm saying. Now, this was a person who was very rhythmic to begin with, and she didn't
Mhm.
have very many. What she was as close to neutral as you're going to get. But we were just experimenting with rhythm and music, and we just found out. We just had some fascinating discoveries, like how I could get these hip flexors to turn off
Mhm.
just by tapping her to the beat. What tightened her up was waltz, 3/4
Mhm.
timing, 6/8 timing, 12/8 timing, until
Mhm.
she counted into groups of fours. Then her hip flexors would turn off again.
Mhm. Mhm. So rhythm practice would be a very powerful
Huge,
grounding.
huge. And what I know is that my dance friends are never in pain. And if they are
Mhm.
in pain, if I test salsa dancers, as long as they have nothing going on with their vision or their jaw on their teeth, when I test salsa dancers, they are so what I call lightly patterned. They're
Mhm.
never a PEC.
Mhm.
They're never bilaterally tight. They're usually just a plain old, what we call someone who's settled into the right side a little bit too much, probably because they sat too much at work for the previous 8 hours. And then I can change all their testing by leading them through a few simple moves. I don't even have to put music on. I can just count it. And as long as they're stepping as I'm stepping and I turn them to their left and not to their right, as long as I turn them to the left, you'll see all their testing change. I've done it a million times.
Mhm.
And I've
Mhm.
shown it a million times. No, not a million times, but I've shown it on my YouTube channel, my Instagram. People don't watch
And
it, but
I've seen it. I've seen it. So have you, when they go home and they're interested in still doing this, you're basically like, find some music that you like and just move yourself to it or find a dance class. That's the
yes,
suggestion that you have for them.
absolutely. It'll keep as
Mhm.
long, but they have to enjoy it. Remember, if you don't like it, then it's not really going to work. You can't force yourself to do something you don't like. But so
Right.
you have to find something that's enjoyable because that dopamine,
Mhm.
I can, when I have someone walk to a beat and it changes
Yeah.
all their tests, I've done this with people. If I have them walk to music that they don't like, nothing changes.
Yeah.
And
Yeah.
that's
It's
the role of emotion. You can't
yeah.
That's why I'm saying, like, the most important thing you have to keep in mind is, let's say you're in pain and you have tension-induced pain. It's not just it could be something from external circumstances. It could be your spouse, it could be the situation you're going through, it could be a boss. If you feel like you can't get out of a situation, that's abuse in a sense to your brain. You've
Mhm.
lost all agency. You're trapped. Sending
Yeah.
kids to school who have to deal with bullies is going to severely dysregulate their systems.
Right.
Constraint. Anytime you have to do something you don't want to do is constraint. Constraint equals tension.
Mhm.
Hunter-gatherer tribes, it's fascinating. One of them, by 4 years of age, because they live in very small groups, by 4 years of age, the kids can make their own choices. They
Mhm.
learn from other kids. And of course, their dynamics are so much different than modern humans in terms, especially in the United States. It's not applicable, but it's apples to oranges. But the point being that if because they study hunter-gatherer societies, see like how did humans live before industrialization and urbanization and things like that. So if there's this natural tendency to let children do whatever the heck they want without it being imposed upon them by their parents at 4 years of age in some of these groups, that
Mhm.
tells me something. To me, it tells me something. The moment they make you go to school and learn what you don't want to learn, they are ruining you. I'm not That's a strong word, but they are inhibiting you. They're inhibiting your natural curiosity. They want you to pass tests so those schools get ranked highly so they can get
Mhm.
state funding. So
Mhm.
they pass those national tests, like they have to meet certain criteria. I get it. That's how the educational system works. But it doesn't mean it's good for some people might be perfectly fine with that. I was not.
Mhm.
Uh, but I think what happens is you get forced into things and your natural curiosity, your natural love for learning can often get inhibited or turned off because you're forcing things to learn. They're forcing you to learn things that you may not be interested in. And then you have to take tests on it and you might not do well in those tests. And now you're labeled an academic underachiever and you're tracked in the basic classes. And now it's, oh, you got it. But now you're not going to get into a good college. And they're constraining you. And
Totally.
that's just how the system works. So I got very lucky. I did poorly in school. I never thought I was
Mhm.
dumb. I was reading 1,000-page history books in the elementary school. No one thought
Mhm.
that was a sign of precociousness. They was like, he can't do math.
Mhm.
And so here I am thinking I'm dumb. Like in some ways, what's wrong with me? Why can't I do this? Why can't I get better
Why
grades?
can't I coerce myself into
Yeah,
doing things that I
because
don't
I
like,
couldn't do it.
right?
I couldn't. So I got
Uh-huh.
lucky. I don't know. It was, opportunity met. When I found Pure Eye, it just brought together everything I was already interested in. So in
Mhm.
that sense, I was lucky I found this discipline because it is psychology, it is
Mhm.
movement, it's dancing, it is every human experience, and I am interested in the human experience. I feel like
Mhm.
I'm an observer of human interaction, and I appreciate human interaction. I like to see how humans truly exist. I'm an anthropologist in a sense, uh,
Yeah.
but cost restoration, because it's not a system, it's an
Mhm.
explanation of psychology, of biomechanics, of rhythm, of the auditory system, of neurology, of the digestive, of food, of nutrition, all of that, of
Mhm.
the environment's impact on you, architecture. There's books written about neuroaesthetics. It's all out there. Different environments influence our brains in different ways. My brain does not like narrow rooms and low ceilings. Put me in a museum. I love museums. But if I look down a narrow hallway, like a lot of museums have, my back, or after about 20 minutes, my back is going to start to hurt.
Mhm.
But I know there's nothing wrong with me. My brain is responding to the environment that I'm in. It's the architecture. Natural straight lines don't really exist in nature. And again, there's books written about this subject. Neuroaesthetics, you can look it up.
Yeah, I'm feeling appreciation for your curiosity about the human experience and how that's brought you to PRI and
Yeah.
all of the threads that brought together.
And the important thing is to remember that as individuals, our histories, our socialization, our what we've learned, our traumas, everything is different. There is no one thing that works for every single person. Yes, are you going to be a right dominant human? Yes. Will over time, will you lose your ability to use your left side effectively? Distinct possibility. Those are the absolutes. That I know. Can everyone benefit from learning how to stabilize their left side better? Yeah. But beyond that, Who knows? There's no way, there's no one way to get every single person to be able to do that better. PRI techniques which are designed to get you to do that process are certainly part of the plan, but what each individual responds to in different positions, whether they're on their hands and knees, when they're lying on their back, if they're lying on their side, if they're standing without support, the impact of gravity changes what people can do. So everyone's a little bit different. There's some absolutes, right and left, and the right side being the dominant side. But after that, it's highly variable. That's why there is no one set plan for every single person.
The penultimate thing that I would love to ask you about is your experience and understanding of different modalities that are in their own way integrative. So I saw in one of your videos, cranial biodynamics textbook. I also saw that you mentioned Tom Myers and anatomy trains. And one thing that has influenced my thinking is the writing of Moshe Feldenkrais. So I wonder how each of those, maybe can start with those three, or if there have been other ones that you hadn't mentioned, how that interfaces with your understanding.
To me, it still comes down to one simple fact: asymmetry. From my perspective, because not one person has come to see me in a new, once you're over the age of 15, 16, you're probably not going to be what we call neutral. If you're not neutral, meaning your pelvis, your rib cage, and your neck are not in a straight alignment when you lie down. And how do I know that? Because your shoulders don't move and your hips, your legs don't move. And there's tests that look like biomechanical tests, but in reality, they are tests telling us whether this individual is on the right side, is oriented to the right, or whether they're in the middle somewhere, meaning they're just resting in a state of neutrality. That means they're passing all their tests. That also means that those individuals who are doing anatomy trains work, who are doing Feldenkrais, who are doing cranial sacral, they might all be great things to help reduce people's tension levels and to get them. I've seen a lot of people who've done Feldenkrais first. The great thing about that is they're already accustomed to the somatic influence of trying to sense your body. A lot of people aren't. They've never done it. So PRI is like, what is this? Why do you keep telling me about my left heel? Or whatever. I keep asking them what they're feeling. So, but if you're doing Feldenkrais, and I'm not bad mouthing in any sense, but if you're lying on the floor, you're standing, and I don't even know the positions that they put you in, but just realize you're not sitting there in a neutral central position. You're going to be patterned. Otherwise, you wouldn't be in that class. If you're not doing things specifically to bias the left side, I'm not really sure what you're accomplishing completely, because you don't have to work harder to get your right side. Your bigger right diaphragm is going to do that for you. You have to bias your left side, the non-dominant side. The only way you can get onto your non-dominant side is if your dominant side, the right side, lets go. But if you don't know that someone's not symmetrical, and you don't know that person standing in front of you has a pelvis that's actually oriented to the right, and a rib cage and a spine that's oriented to the right, but they look straight because you just see the twist. You see the compensation that keeps them straight. If you don't realize that you're looking at the compensation, you're not looking at the actual orientation of that individual. You're looking at the compensation that keeps that person straight. So then you're just really just keeping them on the right side, and everything they're sensing is over on the right side. And
So it sounds like
that's the main difference. I'm not saying any of those things are bad. Anything that can reduce tension levels is a good thing. But in my mind, to fully inhibit that neurological, neuromuscular tension, neurosensory muscular tension, you have to get your left side biased, as in I'm only on my left side and I'm not feeling my right side at all. And that's what PRI techniques do.
Massage, craniosacral, anatomy trains, all of this, you see this as reducing tension. And insofar as it can correct or address the asymmetry, can also help, but it's less direct.
Yeah, that's what I would say. No, but again, that might be what someone needs. Who am I to say
Mhm.
that that's not what they need?
Mhm.
Maybe they'll start flowing again after a massage and their left heel hits the ground again and they're good to go for another month. I don't know. I can't say because pain is so subjective. I'll test the same people. Like I could test people, come out with the same testing. One person might be in a tremendous amount of pain, another person's not in pain at all. I just know they're on the right side. So there's so many different again, do you like your life? Are you happy? I think that might be the most important thing. Are you happy? If you're happy, your pain doesn't hurt as much. If you're unhappy, oh, everything's laborious.
Mhm.
You don't hurt as much when you win.
Yeah, that is a natural transition to the last
Hmm?
invitation, which is you mentioned the influence of Buddhist psychology, Buddhist philosophy, and one of the books that I heard you talking about was one by Lama Surya Das, and I wonder if I would invite or some curiosity to how that journey for you has changed and what it looks like now, your relationship with the spiritual.
I guess I had my aha moments through some of the books on because that was the first book on Buddhist psychology that I had ever read. I started off with discovering what's it called? The Greek. What is it? First, I did find Epicureanism, but I also
Stoicism.
oh yeah, yeah. So I started with Stoicism, then I found Epicureanism, and then eventually I found Buddhism, and then Buddhism was a more complete picture for me than the
Yeah.
other. And I remember there were certain things that I struggled with in life, and one of the major one was the role of expectations. And I always felt like people had expectations for me that I never agreed to, but they would say, "Oh, you should be more like this," or "This is
Mhm.
what you should do." But anytime I did things that people thought I should be doing, I was not happy. And then I realized that when people were saying, so I had a very difficult time in my mind with not upsetting people, but letting people down or disappointing people
Mhm.
because I didn't meet their expectations in some way. But then I realized, especially in personal relationships, not really family stuff, but more like romantic relationships, they wanted me to change for them. This is what I finally realized. They not one said, "Oh, it's so great how you are.
Mhm.
That's such a great thing." It was always like, "Okay, but maybe you'll do this differently, which will make me happier."
Mhm.
And so I kept thinking there must be something wrong with me. What's wrong with me?
Mhm.
Because
Mhm.
that's how people would make me feel. And then I found books like there's a book called Quiet about introversion, and then there's a book called Highly Sensitive People. And those books I also read around the same time that I found Buddhism. And I finally felt like I existed, that there was nothing wrong with me. I'm slightly different. Like the fact that people don't have my intense interests in certain subjects.
Yeah.
A lot of most people do not have those type of interests and they don't understand people that do have those interests. So it was a
Mhm.
lack of understanding. And once I felt validated and say, you know what? No, okay, I might not appeal to everybody. I understand that. And I had to become okay with that. That who I am and the way my brain thinks and the things that I'm interested in now have the ability to help a lot of people. Posture restoration community is the first community, even dancing, I didn't never really felt so I never felt
Connected.
so connected to the dance community. But to the posture restoration community, they actually appreciate how I am. They
Mhm.
appreciate the interest that I'm in, that I have. And I never got that anywhere else in life ever. So
Mhm.
that's it's very important to find a group of people or a job or some sort of community that appreciates you for you and doesn't try to change you. Knowing that the way you are and the way I am is not going to appeal to the average person. I get that. And I'm perfectly okay with that at this point in time. But
Mhm.
I wasn't when I was younger because I kept thinking something was wrong with me. but again, their unmet expectations were not my issue. I never portrayed myself differently. They just thought, oh, somehow he'll be different to please me in the long run. But that wasn't going to happen. So I think I became so disappointing to them. Because why? Because I didn't meet their fantastical expectations. That's their issue, not mine. They imagined a scenario that wasn't the reality. And that's what I realized about expectations. And once I had that epiphany, that was the best inhibition technique I've ever done in my life. Because all that mental tension washed away. And honestly, because I did find posture restoration and Buddhism around the same time, they complement each other so well. Because again, you have to let go. Every time you let go, you can start anew. It's like going into confession. Like you confess your sins and you start over again. You have to be able to let go of whatever you're holding on to. And I needed to be explained in ways that other disciplines didn't make it so obvious. In Buddhism, it's like, this is the issue. This is how you get out of it. You're suffering because you're holding on to something. Let go, end of suffering. It's pretty simple. Theoretically, it's simple, but then you have to actually do it, which is not always the easiest. But if you can let go, you're a free agent. You got freedom.
For you, the conceptual shift was one of the biggest points. Was there also a practice component?
I certainly meditated. I did get into meditation for some time. I can't say that I was ever an avid meditator, but I had my aha moments that I needed to have. And that's what worked for me. And they call it sudden insight in Buddhism.
Yeah.
There's the eightfold path where people can stay on the path to enlightenment, so to speak. But then there's another form of enlightenment that they call sudden insight. And you have these aha moments. And once you have that one aha moment, and the Joseph Campbell books helped me quite a bit also, reading Campbell's books. But once I had the aha moments, I didn't need to meditate on anything at that point. I didn't have to do something to reinforce the aha moment. I already had it. My life changed. So that's the same thing with posture restoration. Everyone has to have that aha moment or they're never going to get it. They're still going to be thinking about muscles and bones. And that's a difficult transition, because if you're a classically trained physical therapist, that's what you're taught.
Yeah. It's drilled into you.
Yeah. So you have to have that aha moment where the light bulb comes on. Oh my God, this is not what I thought it was. And then it takes your life in a whole another direction.
Yes.
So you have to have that sudden insight. Some people never do it. That's just not how their brain thinks. And they will appeal to a certain group of people who also can't think in the way that I'm describing things. It's going to seem like crazy talk. But it doesn't matter how many times I show it in a video. You don't need to stretch your hip flexors. Sorry.
Moving people beyond muscles and bones, I can say amen to that.
It's hard, but it's hard. It takes a different way of seeing things. You have to let go of everything that you've previously thought. And if you just spent a couple $100,000 on physical therapy school, it's hard to let go of that model, especially. Or if you've been doing physical therapy work or any other type of healing modality for so long, that now the idea that you were doing things, I don't want to say incorrectly, but there were things you weren't considering and you consider yourself an expert, that's a blow to the ego to a degree. You can either say, all right, forget this posture restoration thing. I'm not okay. Yeah, we're asymmetrical, but I'm not going to go down that path. That happens.
Yeah, especially when the insurance companies are not reimbursing you.
That's another issue. Yeah.
For this other type of work.
Yeah. The system is not set up for posture restoration. That's why most people who do PRI end up creating their own business. Because they can't do you can't do PRI having 6 people in front of you at the same time. You can't do it in 15 minutes. It's not how it works. We're all individuals. You can't mass produce it. So you have to have an hour to spend with somebody. My initial sessions are an hour and a half because I do things a certain way. You can't, this is not in and out 15 minutes. That's the business plan for America.
Mhm.
And not only America, I'm sure this is how physical therapy is practiced in most countries at this point.
Having been exported around the world, I think a lot by American culture. Yeah, I'm feeling whole and grateful for all of the sharing of your knowledge and your experience. Are there any lingering things that you would either like to say or ask?
I don't know. I don't think so. We talked about the big picture, and
Mm.
you don't have to. That's always the hardest part. You don't want to get bogged down, and yeah, I always say you don't want to chase muscles and say, oh, but what about this muscle and this muscle? And your brain doesn't know what those muscles are, so why do you care? I know what the muscles do, and I know what position to get you in to feel those muscles appropriately. But at no point do I think it's about one muscle. You need individual muscles to make the whole system work. But again, I can turn on your hamstrings by having you look to it in a different direction. The brain, it's what the brain is sensing and doing is what produces the muscular output. Yeah, that's you just have to understand the bigger picture, and then you can start to learn the little details. But if you never understand the bigger picture, it's hard to make that leap and to understand everything in totality because you get too overly focused in one, like on a knee or a hip, not realizing the other parts of the body, the tensegrity structure that the human brain and body really are, is also influencing that hip and that knee. So that hip pain might have nothing to do with that left hip or that right hip, whatever it's going to be. That's just where your tension is being held. That doesn't tell me what the issue is, though. You don't own a hip. You say, "Oh, my hip hurts." When you say "my hip," do you possess a hip, or is it part of you?
Mhm. You are a hip
You are a hip, right?
and a
Exactly.
body.
That's what I'm. Yeah. So you have to be able to see it in two different ways. Yeah, you
Yeah.
have a hip in the sense that it's part of your body, but at the same time, you are your hip. So
Yeah.
you have to be able to alternate between two realities of rest of body, hip, rest of body, all part of the same system and the brain that runs it. So you have to be able to philosophically be able to not feel like things are contradictory.
It's like when people are in traffic and they're like, I'm stuck in traffic. And then you alternate, you are traffic too.
Like if you're, let's say you're in Boston and you're
Mhm.
walking down the street,
Yeah.
busy day, and there's hundreds of thousands of people walking around. To you, you're the center of that universe.
Mhm.
Everyone's revolving around you. But to
Mhm.
everybody else, you're the environment.
Yeah.
So, yeah, you're separate from the environment, but you also are the environment.
Yep.
You have to be able to see it that way. Otherwise, you're just never going to really get the big picture, so to speak. And
Mhm.
also, like traffic, something like traffic is quite, or a delay on a train. New Jersey has terrible NJ transits constantly delayed. Let's say you're in a rush to get home and there's a delay. Oh, you're going to be so angry. But let's say you're not really in a rush to get home and the person next to you is really attractive and they're talking to you. Ooh, that delay is
Mhm.
not so bad.
Mhm.
So it's conditioned. Like the underlying context is changing. Everything is conditional.
Mhm.
That delay, that traffic in one condition might be the worst. But if you're on a date and oh, we're stuck in traffic and I really like this person, not so bad.
Mhm.
Everything is conditional, and that's what people have to realize. Changing conditions creates changing nervous systems.
Mhm.
There's nothing static. Good days and bad days. You just can't get caught up in the bad days and thinking it's going to last forever because it won't. And you can't get caught up in the good times because those won't last forever either. And as long as you can accept the ebb and flow and the flux and the flow of life, you'll be okay. But if you hold on to the good and you don't want to let it go, or you're fearful that the bad will never let go or will never end, well, you're creating tension. You got to flow. That's why it is very Eastern philosophically. Flow like water, as they say.
Thank you, Neil.